Hey folks, how you doing? If you're watching this video right now, you probably Googled something about Medicare Advantage plans in CT or Medicare Advantage plans in Connecticut. I'll tell you what, my name is Rob and I'm a 17-year veteran agent of insurance, and I represent all of the major Medicare Advantage plans here in Connecticut. So anyway, with that said, I just wanted to give everybody a quick rundown of what these plans are all about in case you didn't know or you needed a reminder. However, for those that do know and they just want to get a quote, there should be up above me somewhere, there should be a click here. If you click that link, that'll take you to another link. You just click on that. It'll bring you right to my website where you can get quotes for all of the major Medicare Advantage plans out there. So anyway, if you want to hang around though and learn some more about Medicare Advantage plans or what is called Part C, follow me along here because I'm going to give you a brief summary right now. Basically, a Medicare Advantage plan, or what is known as Part C of Medicare, it's really a health plan all unto itself. So basically, if you enroll in one of these plans, you still have Medicare. However, Medicare now is kind of in the background. The primary payer of your medical bills, your hospital bills, that type of thing, now gets paid by the plan itself. So with that said, you now have to follow the plan's rules. You kind of almost have to forget about what you learned about Medicare because a lot of those deductibles and that type of thing do not apply, like your Part B deductible, some of the co-insurances. It's all different on these plans. However, I want to stress that you always have Medicare. You're always enrolled in Medicare. You don't lose it. It's just that the way that the claims get paid and the co-pays that you're responsible for are now, you have to follow the health plan that you enroll in. And here in Connecticut, there's about 5 different companies that offer these plans. And within each company, there's usually 2, 3, 4 choices that you can enroll in. And a lot of times, it really falls under what you want to pay for these plans. Some companies charge $99 a month. Some charge $129 a month. Some charge $29 a month, and some companies actually have a zero premium plan. Okay, and I said that right, folks. Zero premium, meaning you don't pay anything for the plan, but you do have copays. And obviously, if you enroll on a zero premium plan, your copays are going to be higher than if you went into one of the $99 plans or the $129 plans, that type of thing. So you have to really balance. You have to look at the copays and also look at the premiums to decide what plan might be most advantageous to you. And I'll give you an example. If you're somebody that just turned 65 and you don't go to the doctor's a lot other than your checkups, that type of thing, and you don't go into the hospital for treatments or that anything of that nature, a zero premium plan might be right for you. Whereas let's say you're somebody a little bit older, maybe 75, and you know, as we get older, we break down. You may need to go to the hospital more. You may go to the doctors more. Well, then maybe one of the premium plans might be right for you. So anyway, with that said, I'm just going to review. I'm actually going to give you an example of what these plans look like. And again, I can't say the name on video. You'll just have to head over to my website to find out more information. But this particular plan would be $29 a month, okay? And it's the annual out-of-pocket maximum. In other words, the most you could pay in copays on this plan would be $6,000. So again, that protects you so that you don't get killed with copays. So with that said, just doctor's office visit. If you went to the primary care provider, you would pay a $15 copay. If you had to go see a specialist, you would pay $40 copay for your visit. Preventive services are zero copay. If you had to go into the hospital, the first 4 days that you are there, you would pay $395 a day for the first 4 days. After that, day 5 and beyond, you would pay a zero copay, okay? Skilled nursing, if you went from the hospital to skilled nursing, the first 20 days would be a zero copay, days 1 through 20. After that, days 21 through 58 that you're in there would be $160 a day. Then after that, from days 59 through 100, you would have a zero copay. So it's kind of tiered. You know, you go up from 0 to 160, back down to 0. But after day 100, all costs for skilled nursing are going to be on you. These plans are not designed for long-term care. They're only designed for a short-term care. So anyway, with that said, I'm looking at some other things. Home health care. Let's say you came from skilled nursing and went back home. Home health care is a zero copay. Lab test services are a $20 copay. Outpatient x-rays are a $17 copay. Ambulance is a flat copay of $275, and emergency care would be a $75 copay. So anyway, there is, and again, that's just a small example of what these services cover, of what these plans cover. Everything that's covered in original Medicare is covered under these plans, as well as there are some extras. Some plans include dental, some plans include gym memberships, that type of thing. Really what it comes down to in selecting a plan, you have to make sure that your doctors and your specialists and your hospitals are included in the network of doctors on these plans. You got to make sure what you'll do is you'll go over over these plans with your agent, and you'll look at the directory, and you will make sure that your doctors, your specialists, your hospitals are covered. That's really going to dictate whether the plan is going to be right for you or not, because if you enroll in a plan and your doctors aren't covered, then your bills aren't going to get paid, and then it would have been a waste of time. You would have been better off going with straight Medicare and a Medicare supplement plan. So anyway, in speaking of Medicare supplement plans, if you find that maybe a Medicare Advantage plan is not appropriate for you, I also do Medicare supplement plans, and those are the opposite. Typically on Medicare supplement plans, you would pay a flat premium, and basically your copays and your deductibles along with Medicare, you wouldn't have any for the most part. But again, Medicare supplement plans, you're going to pay a lot more. Some of these plans are $200 to $300 a month, depending on what plan you go with. So again, you really need to work with an agent, a qualified agent such as myself, to determine if a Part C Medicare Advantage plan would be right for you, or if you'd be better off going with a Medicare supplement plan and a Part D plan. And one other thing I forgot to mention was that Medicare Advantage plans typically include a Part D, or what's called a drug plan, as well inside of the plans. And again, you would have copays for those. But to learn more and really go in depth into what all these plans cover, you'll have to head over to my website. There should be a click here button now above where you just click on it. Then you just click again where it says click website. Click on that. It's going to bring you right to my website. Or if you just want to type it in yourself, it's www.lifesolutions.ct.com. So head over there now and you can get live quotes right off my website, or you can go over to the video section, hit that tab. You can learn all about, you can get more video tutorials just like this one for your Part A, Part B, Part C, Part D. Thanks so much, and I look forward to working with you here in Connecticut on your Medicare plans. And remember that open enrollment AEP is right now, October 15th to December 7th. So that's the time you have to enroll in these plans. Thanks so much.